the Middle East Psychological Association. She specializes in behavioral counseling, cognitive behavioral therapy, and offers psychotherapy to people going through emotional and psychological difficulties. Her efforts to connect with those who need counseling has left an indelible mark on many. So, welcome, Dr. Navjot, and over to you.
Thank you, and Dilip. Thank you so much. Thank you for the kind introduction. A very good evening to Institute of Chartered Accountants of India, Kuwait chapter, organizers of this event, Chairman Mr. Sriram, outgoing Chairman Mr. Deepak Bindal, and lovely audience of today's evening. Thank you so much for having me here. My appreciations to ICAI for organizing this webinar and raising awareness on the topic of health. Health is wealth in the real sense, and that is what past 2 years of pandemic has taught us. So health is new wealth and happiness is new rich. So today I'll be taking you through the topic of enhance your happiness and well-being. We human beings are hedonists by nature. Hedonist means that we all want to be happy. We all want to seek pleasure. No one wants sadness. And I think you would agree that we all want happiness. We all are in the pursuit of happiness, but are we really happy? What are the things that block our happiness? So today we'll be exploring on the topic of what blocks our happiness and what can be done to become happy, what can be done to enhance our happiness. So without further ado, let's start today's topic. Let me share my presentation. Can you see my presentation, please? Someone please give me a thumbs up if you can see.
Yes, yes, we can see that. Thank you.
Thank you. So what is happiness? It's actually state of mind. It's how we perceive ourselves and how we perceive the world around us. Sonja Lyubomirsky wrote a book, How of Happiness, and there she tells us that happiness means experience of joy, experience of contentment, positive well-being. And when one feels that my life is good, my life is meaningful, my life is worthwhile. So if we experience such things, we feel our life is meaningful, it is worthwhile, it is good, and we experience joy, contentment, and all that, that means we are happy. But if we don't experience these things, what is it that blocks our happiness? And what can be done to become happier? What can enhance our happiness? So today we'll be looking at these things. We'll be exploring these things. There are many things that block our happiness, but I have listed just 5 things because of the time constraint. And these are thinking errors, mindlessness, low frustration and distress tolerance, fear of missing out, and lack of purpose. So let's take them one by one. We human beings think. We think all the time. Even when we are asleep, we think. Now, what happens when we think? Sometimes we take some biased perspectives on ourselves and the world around us. So these thinking errors are the irrational thoughts and beliefs that we take on ourselves and others, and we unknowingly reinforce. And these are so delicate, these are so subtle that we don't even know when they become a part of our life, when they become a part of a regular thought process. And these have the potential to cause damage, potential to cause psychological damage, because we don't recognize them as something that can be changed or that needs to be changed. We think of them as something that is a part of us. Like they are like friends, close friends, but they are actually our enemies. So these thinking errors, they give us a lot of unhappiness. They make us sad. They lower our self-esteem. So let's see what are these thinking errors. First, I would like you to see this figure. What do you see in this figure? I think your answer would be you see a triangle and you see a square. I hope you all can see that.
Yes, yeah. We see a triangle and...
Yes, sir. So this is what our mind does with us. It sees the things that are not. Actually, there is no triangle and there is no square, but we perceive it as a triangle and we perceive it as a square. So this is what our mind does. It sees the things, or it perceives the things that are not there, and it overlooks the things that are there. So we are overlooking the black part, okay? So there are around 20 thinking errors, but I cannot cover all of them. So I have just taken 8 thinking errors. First one is black and white thinking. I think we all think in black and whites. We think in the extremes. We think in absolutes. If we do something, if we have not done it perfectly, we think that we have failed in that. Like we see the shades of black, we see the shades of white, but we don't see the shades of gray. So if you don't do something perfectly, you feel that you are a failure. If your partner hurts your feeling once, you think that my partner does not love me at all. If you have made a mistake at work, you think you are not competent. Sometimes we think that my way of doing things is the correct way. Only I think correctly and others do not. So this is black and white thinking, and this gives us a lot of unhappiness. Second is jumping to conclusions. We human beings, we have a tendency to jump to conclusions without examining the evidence. And this thinking error manifests in 2 ways. One is we read others' minds, and the second one is fortune telling. I think we human beings, when we meet someone, maybe it's a new person, maybe it's the regular person that we meet every day, we think that we can read other person's mind. And we make assumptions about ourselves and we make assumptions about others. We may think, people think I am dumb. Or we may think, people don't see me as smart and capable. But maybe it's not people, it's my own thoughts, it's my own perception. Then we indulge in this fortune telling. So fortune telling, no one can predict future, but we do that. We feel today is going to be a bad day, or I'll never be happy. Things won't go my way. So we just predict future, but no one can predict future. Just imagine 2 years we were in the pandemic. Could anyone foretell it that in the coming 2 years, we all will be like, our life would be thrown out of the gear, or a life would be disrupted by a small virus? Nobody could do that, but we human beings do that. And when we do all those things, they affect our happiness levels. Third thing is shoulds and must. These are the statements. These are the ironclad rules, I would say, that we have made for ourselves. Now, what we do, we have some lists in our mind, should not. Like I have my own list. I should do this, I should not do this. Then I have for my partner, I have for my kid, I have for my boss. Should not, must not, okay? So we all have these lists. And what happens when we cling on tightly to these should and must statements about ourselves? We feel guilty. We have that guilt. We feel ashamed when we can't do that. So we feel that we could not live up to our own expectations. We could not live up to those shoulds and should nots. So we have guilt. And what happens when we have these shoulds and musts for others? Like my boss should do this, or my boss shouldn't do this. But boss does what you didn't want him to do, and boss didn't do what you wanted him to do. Then what happens? You are disappointed by their failure to meet your expectations. And as a result, you have negative feelings about them. You have resentment, you have anger, you develop hatred, and all these things, they give us unhappiness. Next thing is we always disqualify our positives. We all have strengths, we all have weaknesses. No one in this world is perfect. We all have shortcomings. We all have something that is good. Now, what happens if somebody praises us for something that is good in us? We disqualify it. We do not take credit for that. We just excuse that praise. We don't take those compliments as genuine compliments, and we just think that, oh, this person is just trying to please me. You are appreciated at your work that, oh, you did this thing very well. But what we do is we think, oh, maybe this person is just trying to please me, or maybe this person is just being nice, or this person does not want to discourage me, or my boss doesn't want to. So we are not taking the credit for our positives. So this thing also gives us unhappiness. Then we overgeneralize. We have this habit that sometimes bad things happen to us. Once bad thing happened, second time, then we think that in future, every time bad things will happen to me. So we overgeneralize. When we use words as never, ever, always, I am the one who always suffers. I never got true love. I never got good things in my life, okay? Every time I'm the one who has to suffer. So we overgeneralize. And all these things, they rob us of our happiness. Next thing is personalization. We take things personally. Whatever happens, or maybe people are behaving in a certain way, we think that this is directed upon us. We take it personally. And sometimes we go to such an extent that we take all the blame on ourselves. Maybe it's not our fault, but we take. You go to a party and party didn't go well, and you take blame for that. I went to party and that's why party didn't go well. You are taking blame even if it is not your fault. So when you do such things, they give you a lot of stress and they make you sad, they make you unhappy. And sometimes we put blame on others. When we blame others, what are we doing? We are assuming the role of a victim. We feel that we are victims. So we have self-pity. We feel and we like to get pity from others also, that people sympathize. Oh, poor thing. Oh, you are the victim. People always do bad to you. Okay. So we assume the role of a victim and we start feeling good about feeling bad. And this thing affects our self-esteem levels. It makes us sad. It makes us unhappy. Then there is something called always being right. Some people think that they can never be wrong. The idea they can be wrong, they cannot digest it, okay? And they sometimes try to fight to a metaphorical death to prove that they are right. I think a good example is that when people write comments on social media, you might have seen that, okay, whenever there is some religious opinion or some political opinion, people just argue with each other for hours. They spend hours fighting or they spend hours arguing, and sometimes they even resort to name calling and all that. So this idea of always being right, that also gives us a lot of unhappiness. And the next one is labeling. Sometimes we label ourselves. We say, I am dumb, I'm good for nothing, I am utter fool. Or sometimes we label others also. My boss is a jerk, my boss is like that, my mother-in-law is like that. So we label, and sometimes we mislabel. We use very bad and emotionally charged words for others. So all these things, they give us a lot of stress and they rob us of our unhappiness. Now, how to overcome this? There is a technique called cognitive restructuring, reframing your thoughts. Now, what happens whenever you have upsetting thoughts, whenever something robs you of your happiness, or you feel that, oh, this thing is overwhelming me, write down that thought on a paper and then try to find out whether this thought is a fact or it is an opinion. Because most of the thoughts that we human beings have, they are our opinions. They are not facts. They are just creation of our own mind. So try to identify facts and opinions. And then try to reframe your thoughts, try to rewrite your thoughts in a different way. So this will help you to gain an understanding of your own thoughts, and maybe you will feel much more happier after knowing that, oh, this thought was just a creation of my own mind. Coming to the next thing, mindlessness. I think this topic is very much common these days. Mindful living is the living when we are fully aware, when we are fully attentive of what is taking place around us, what is happening in the current moment. Right now, this webinar is happening, but many of us are like, we are not here. Maybe our mind is wandering somewhere else. Okay, so that is the state of mindlessness, when we are not fully aware of what is happening in our surrounding, what is happening in the present moment. So that is the state of mindlessness. And we human beings, we have become mindless. We are living our lives on autopilot. I hope you all know what is autopilot. So we are on the autopilot. We don't know what is happening with us. Okay. And what we do is, when we are on that autopilot thing, we zone out of the present and we either go to our past or we go to our future. So our mind has this enormous power of thinking, and thinking about the things that have already happened, or it's already over, or thinking about the things that are yet to happen, or maybe they may not even happen, but we keep on thinking. And what happens? We become mindless. We do not enjoy the present moment. And if you remember, some people say that present moment is called a present because it helps us to enjoy the now. But we don't do that. We do not enjoy the present moment. And we are always caught up in the past. We are always caught up in the future. So try to become mindful rather than being mindful. In this slide, you can see this mind is full. This is full of garbage of thoughts. So many things, past, what happened? Why did this thing happen? Who is to be blamed for what? All these things come to our mind. But here, the mind is mindful. The mind is just concentrated in the present time, in the now. Okay, so try to become mindful. That will help you to become much more happier. So how to overcome? By learning mindfulness skills, by paying attention, and by being completely in the present moment, and taking one thing at a time. I think, I know that these days people are too much into multitasking. They do so many things at a time, but I think doing one thing at a time helps us. Because when we do, you are eating, you're watching TV, you are on phone, you're talking to your wife, you're doing so many things at a time. So you are not doing justice with any one thing, okay? So try to do one thing at a time. So try to become mindful, try to get fully immersed in whatever you do at one time. Next thing that robs us of our happiness is our low frustration tolerance. We human beings, we have a very low frustration tolerance. Now, when do we get frustrated? When our needs are not met, when we do not achieve our goals, and when there are obstacles, we feel frustrated. And when we have low frustration tolerance, it can lead to unhappiness, it can lead to bad mood, and again, we become unhappy. So how to overcome this low frustration tolerance and how to build a threshold for frustration tolerance? We have to avoid entitlement syndrome. Now, what is this entitlement syndrome? We human beings, we think that we are entitled to good luck. We are entitled to good jobs. We are entitled to love. We are entitled to respect. We are entitled to good health. We are entitled to good fortune. We think we have this ideal in our head that we human beings are entitled to all these things. Now, what happens? Reality is completely different. Life, as we know, it's a roller coaster ride. There are highs, there are lows, there are ups, there are downs. And you cannot get off that roller coaster ride before completing the ride. So same is with life. So in life, we have to go through ups and downs. So there will be valleys of joy, peaks of joy and valleys of sorrows, but we cannot get off that ride before completing that ride. Now, that is reality, but we have a different ideal in our head. We think that we are entitled to all these things. We can't be unhappy. And when such things happen to us, when we have difficult situations, when we have tough times, when we fall ill, when we are sick, when something goes wrong, we try to compare our reality with the ideal in our head. And then there is a mismatch between two. And when there is a mismatch between two, there is a discord. We try to twist reality. We try to change reality, but we cannot change that reality. So the first thing that you can do is you have to avoid this entitlement syndrome. Other things that you can do to improve your low frustration tolerance is we all need to learn to respond than to react, because we human beings have not learned to respond. We just react. Something happens and we just react. So what we can do is we have to learn to take a pause. We should take pause, think over the situation, and then we should respond. But what we do is we just react to things, and then things go wrong, and then we become sad, we become unhappy, we have problems, okay? And the second thing is we should stop expecting too much from others. I know we are human beings and we expect something from our friends, from our family, from people whom we work with, or we expect, but stop expecting too much, because our expectations, they are the root cause of our heartache. And then we feel bad. Then the next thing that we can do is we can change our expectations over bending reality. Instead of changing reality, instead of cribbing about reality, instead of retaliating and feeling bad or like saying that why this thing happened to me, we can change our expectations. And we all should account for obstacles. We all should expect obstacles in life. This is the biggest mistake, that we think that we won't have any obstacles. We won't have any setbacks in life. We won't have any problems in life. So we all should be prepared for these things, because these things will be there. There will be ill health, there will be rejections, there will be criticism, there will be problems. So we all should be prepared for these things. So this way we will improve our frustration tolerance threshold. And when you have that frustration threshold, then maybe you won't feel that much of sadness, that much of negativity in your life. The next thing that is related to it is low distress tolerance. So we also have low distress tolerance. When negative things come, we feel that we cannot cope with this, and the negative emotions are too uncomfortable. And what we try is we try to escape them. We try to avoid them. Now, why distress intolerance leads to problems? Because we fear negative emotions. We try to avoid distress, and the more we try to avoid it, the worse it gets. Yes, that is clear that when something is unpleasant, we should try to avoid it. Okay, but that works for some situations. For example, if it is hot inside, you can come in, and that is okay. You can go indoors and you can avoid that. If you're hungry, you can eat food. If you have pain, you can take a painkiller. But what we human beings do, we try to apply the same strategy to our emotions. But it does not work with our emotions. When we try to avoid our emotions, when we try to escape from our emotions, the things get worse. So fear and avoidance of distress amplifies distress. So avoidance fuels anxiety. Now, how can we overcome this? We have to learn distress tolerance skills. Now, this thing is very helpful whenever we are in the distressing situations. We have some common beliefs related to negative emotions. We all have been taught like this, I think, that, oh, I can't stand this. I hate this feeling. I'll go crazy. It is unbearable. This feeling won't stop. It is weak to think this way. I think we all have been taught like that. And we are teaching the same things to our kids. When they become sad, when they become upset, when they become angry, we try to pacify them. We try to soothe them because we feel this is not right. But all emotions are okay. All emotions are good. And we should teach our children to sit with their emotions and to tolerate that emotional stress. And we should also learn to identify and challenge these beliefs that we hold about these emotions, these beliefs that we have. So we should try to change. We can say, yes, this thing is not good. I do not like this feeling, but I have to learn how to sit with this emotion, how to experience this emotion. So try to experience those emotions, try to sit with those emotions. That emotion will eventually pass, because we cannot be in one emotional state forever. You cannot be in that angry state forever. You cannot be in that sad state forever. So that emotion will eventually pass. So we should try to change our beliefs that we hold about our emotions, and we should learn how to sit with difficult emotions, distressing emotions, and we all should learn to balance how to tolerate emotional discomfort, because we have not been taught that. Nobody taught us that, okay, if you are sad, sit with that emotion, experience it for some time, and then only you can experience what happiness means. So we have to, this way we will improve our emotional experiences. Next thing that is very much relevant in today's world is FOMO, or fear of missing out. I think we all remain glued to our screens, our smartphones. So we all do that because we don't want to miss out on any important information. And we have this fear that if we do not check our phone, we'll miss something that is important, we'll miss some important updates, we'll miss some relationship, or we'll miss something that is very important. And there is an underlying perception that others are having more fun. People are living better lives. They are experiencing better things. And all this gives us a deep sense of envy. It affects our self-esteem. When we see that people are posting about their foreign trips, people are posting about their holidays, people are posting about their, like, what they ate with, they went to a fancy restaurant. So they are posting all these things. People are posting. These days, people post each and everything. Okay, even they are posting their personal things on social media. So what happens is there is a deep sense of envy, and it affects our self-esteem. Now, when we do all this, our gaze is not on ourselves, that what we are doing. Maybe you are enjoying a wonderful party, but you checked your phone and you saw your friend is having good time at the beach. So maybe your party is better than your friends, but you still feel that you missed that experience. So you worry about that, or you are very disappointed that you missed out on that thing. So we focus on others. We do not focus on ourselves, and we are not in the present where we are. So our mind gets distracted, our mind goes somewhere else. We feel disappointment, we feel dissatisfaction, and all this gives rise to stress, sleep disturbances, low mood, low self-esteem. Sometimes people may have anxiety and depression because of this. Psychologists say that behind this FOMO is a social phenomenon called social comparison. Now, what we do is we compare our lives with others. And when we compare our lives with others, definitely we feel bad that, oh, others are having a good life, others' lives are better. And that is why people post, people update about themselves, because they just want, they have this inherent feeling to show that they are better off than others. And we compare, and when we compare ourselves, we feel bad that we don't have such experiences. But believe me, whatever people post on social media and internet, that does not give a very well-rounded picture of their personality and their lives. Maybe it is the cherry-picked version, perfected version of their life. It is not the real picture of our life. But when we compare our life with their life, we feel bad, we feel miserable, and we feel that, yes, others are having good life and our life is not worthwhile. So that also gives us a lot of unhappiness. Now, how to overcome this FOMO? FOMO should be changed to JOMO. Now, what is this JOMO? JOMO is joy of missing out. Now, there are joys of missing out. We don't want to miss out, but there are joys of missing out too. So this picture can tell you, this is fear of missing out. Person is hooked to the gadgets. Person is checking others' posts. Person is checking others' updates. Negative thinking. Mind is distracted. Cannot sleep. Person is feeling dizzy. Now this is JOMO. On the other side, person is not at all bothered about others. Person is busy with his life, person is enjoying, person is trying out new things. So you all can do that. You can use your time in a very productive way. You can do something that is your passion. You can try out new things. You can try new things, new experiences. So all this will help you to become a better person. And then you won't have that fear that, okay, I'm missing out on something. You'll enjoy your own company, and you will be improving on yourself. Okay, so always change your FOMOs into JOMOs. Restrict your screen time. Instead of having screen time, have person time. Interact with people, talk to people. That all will give you a new meaning of life, and that you won't feel distressed by updates of others. So embrace the joy of missing out. It will give you a time to reflect on yourself. What am I doing with my life? What is happening in my life? So disconnect from all that, disconnect from this maddening internet and social media world, and try to reconnect with yourself. Try to reconnect with your spiritual self. Try to reconnect with your inner self. Try to find out your passions. Try to reconnect with your family, with your loved ones. So you'll feel so good about it. So embrace joy of missing out. The last thing is lack of meaning and purpose. So we all know that purposeless life is no life. So when we do not have a purpose of life, that gives us boredom. We feel bored. We feel that my life is not going anywhere. We have anxiety, we have depression, we feel bad about ourselves. And we have witnessed all this during lockdown. So during lockdown, we had no meaning, like we had no work, nothing was there, no purpose was there. So we felt a lot of boredom, we were overwhelmed, we had anxiety, we became sad, like all these things we have experienced. So try to find purpose in life, try to set realistic goals for yourself and work on those goals. Then there are some other ways to enhance your happiness and well-being. So let's go through. There are only 5. I won't take much of your time. We all get so caught up in our day-to-day affairs that we do not find time for ourselves. So we should love ourselves. So all of you should have nothing or me time. You should take care of your health. You should have healthy eating and sleeping habits. Spare some time for your loved ones. When you're pressed for time, say no. And this is very important. Always acknowledge and appreciate for small achievements. That is what we do not do. What we do is we wait for the big moments. We wait for the big things to happen in our life. And then only we want to appreciate us. But maybe those big things won't come. So appreciate yourself for the small achievements. If you do a small thing like making a cup of tea for your wife, appreciate yourself. If you do a small thing for your child, if you do a small thing to make someone happy, appreciate yourself. Okay, this way you will feel much more happier. Then research says that kindness is linked to happiness. Even the smallest act of kindness, even if you gave water to someone, or if you gave 100 fills to someone, that will make you happier. And researchers have found a relationship between generosity and happiness. They did fMRI studies and they found certain areas of brain. They showed this warm glow. There was some activity seen as warm glow in their brain areas when people completed the acts of kindness. So that clearly shows that kindness, generosity, all this is linked to happiness. So if you want to feel happier, help someone, be kind to others. The next thing that we all should learn is to let go. So we should let go of things, let go of judging yourself, let go of judging others, let go of the past hurts, resentments. We all have self-limiting beliefs. So let go of those self-limiting beliefs. Let go of the people who drain your energy. Let go, let them go. Okay. And let go of the need to control others and to be controlled by others. Then the next thing, it has the research backing that exercise, prayer, and meditation, it has positive effect on our health, our mental health, and our well-being. So exercise, pray, and meditate. If you can't do all the things, at least do one thing, exercise or pray or meditate, or if you can do all the things, that's well and good, because this leads to enhancement of our happiness and well-being. The next thing that we all can do is practice forgiveness. I know it is easier said than done, because forgiving someone, it's a big thing. It takes a really big heart to forgive someone and those who have wronged us. So there are people who have wronged us, who have done bad to us, who have hurt us. So try to forgive them. And this forgiveness won't come overnight. You have to cultivate it. You have to it will go many times. If you will try to forgive them, only then you can forgive. So hate, regret, grudges, all these things, they keep us trapped in the past. They keep us trapped. So in order to come out of that, please forgive people, because it's not for them. It is for your mental peace. And when you feel that mental peace, inner peace, you will experience happiness. So please forgive people. Forgive yourself for all that you have done to yourself. Forgive yourself for the harm you have done to others, and forgive others for the harm they have done to you. The next and the last thing, count your blessings. There are so many things to be grateful for, but we human beings, we are so thankless that we don't thank God. We don't thank God for all that He has given us. We are living perfect lives. Our lives are so good. We don't have any problems. We are leading very good lives, but still we are not happy, and we are always cribbing. We are always complaining about the things. So instead of complaining, be grateful to God. Be grateful for so many things that He gave you. And this will definitely help you to feel better, to feel good, to feel happier. And it is rightly said that it is not happiness that brings you gratitude, but it is gratitude that brings you happiness. So I end my presentation with these words, and I would like to express my heartfelt thanks to you all for listening patiently to me. Thank you so much for having me, and thank you so much for listening to me. Thank you. If you have any questions, you can please ask.
If the members have any question, you all can either raise your hand or type it out in the chat box.
Thank you, Dr. Kaur. The one thing which stuck to me is the JOMO. I will always remember this, and it will remind me, if I'm going through FOMO, to change it to JOMO. Thank you, Dr. Navjot. Yes, it's very well laid out. Yeah.
Thank you, sir.
Dr. Kaur, thank you so much for your enlightening words. And I think, some of these intricate concepts we really never knew actually existed, so we just sailed on them as if it is, normal. But when you told about, these expectations that we hold even without our intentional, knowledge, that's very intricate. And thank you for bringing it up to our attention. And definitely it's a great session for all of us. Thank you.
Thank you, sir. Thank you.
Yeah, I think we can move to second session.
Correct. Thank you, Dr. Kaur. I would invite Andalib back.
Thank you so much.
Thank you. I would invite Andalib back to introduce our next speaker and then take the proceedings forward. Thank you.
Thank you, Shriram, and thank you, Dr. Navjot. It was a really insightful and thoughtful session. Thanks a lot.
Thank you
and
so
now,
much.
Moving on from mental health to a very important part of our physical health, for this segment on preventing and identifying heart diseases, we have with us Dr. Thomas Koshi George, who works as a cardiologist at the Chest Hospital. He's a former assistant professor at PSG Institute of Medical Sciences and Research, Coimbatore, and has over 25 years of experience in cardiology. He is European board certified in adult echocardiogram and has also completed his MRCP from the UK. He is also the Joint Cultural Secretary of the Indian Doctors Forum. Welcome, Dr. Thomas, and over to you.
Thank you very much. Good evening, dear friends, people, and I'd like to thank especially the president and the chairman, and the ex-chairman, Mr. Deepak and Mr. Sriram, for inviting me and giving me a chance to speak in this allied group. And actually, I wanted to talk about prevention, but Mr. Deepak had requested me that that the members all want little more than prevention, like what are the symptoms, and so I'll go briefly on that, but my main focus will be on prevention. I hope you can see.
Yes,
yes,
we can.
perfectly visible.
Yeah. Okay. So, what is heart disease? So, it is, as you all know, the heart is really one of the most hardworking muscle of our body. It's working full time. There's no stop. If you stop, you're finished. So it keeps on pumping for 4 to 5 liters of blood every minute. So it has to give all the nutrients and oxygen to all parts of the body, including itself. And the arteries which surround the heart is called the coronary arteries. Now you have a normal blood flow, but what happens is normally it is a clean flow. There's no block here. But because of atherosclerosis, which is basically fat, which is building up in the space, so that time something called a plaque occurs, and then it decreases, narrows the space, and that's when all the problems starts to happen. This is from the US. Of course, most of our data is from the West, especially the US. And you can see the leading cause of death all across the board, whether it's males or females, it's cardiovascular disease, much more than cancer. And if you see the deaths, this is comparing cardiovascular death and cancer. So these are the two top leading causes of death. And you can see as we grow older, everyone wants to grow old, so, but everything has a price. Unfortunately, as we grow older, you are likely to get heart disease. Okay. It's a very few subset who escape heart disease. So it's a number one killer and number one problem as we grow older. Unfortunately, now we have seen a different trend. So as I told earlier, normally this is how the artery is if you cut it. And then slowly, if you are, because of different risk factors, which I'll go, you may have something called the foam cells. It gets deposited in the inside of the artery, and then starts to build up. A cap will cause, and that's called a lipid core. And then you will get a clot, which is a thrombus. A blood clot will come, and then it will decrease the blood flow of the artery. And if it fully blocks, this is what you get, a heart attack. One thing you have to understand is people think that, only when you grow old, you have fat deposition, this atherosclerosis. But, research has shown that even from the first decade, how do they know first decade? Unfortunately, there are some babies, some children who pass away due to any recent accidents or some other illness. And so they do the postmortem, and they found that from such a young age, from 2 years onwards, fat starts to deposit, So it's a myth you think that it happens in the old. It starts at a very young age. So we have to actually take care of ourselves from a very young age. We should not think, okay, later on as I'm growing older, then I'll get better. I'll have a healthier lifestyle. No, we have to start early. So that is one thing we have to always follow. So is it only the heart which gets affected? No. It can affect any organ, So the same way as the arteries get clogged into the heart, the same way it can block anywhere else. It can block the brain, the legs, the kidneys, anywhere, any organ. So what are the warning signs of a heart attack? Now this is tricky. So if it's very straightforward, that I must say, then you are lucky that you have that typical chest pain, which is in the center, okay? So you have the center of the chest, retrosternal chest pain, you say, oh, can be the left or on the center. And classically, it can radiate. Okay? It can go from the chest to the arm, usually the left arm, can go up to the neck, can go to the jaw. So rarely can go to the right. And sometimes it can even go to the stomach, epigastrium. You'll have some patients will say that they have an abdominal stomach, they are having the stomach, some fullness, some gas, so that could be an heart attack, unfortunately. So you have to be always careful, especially when you have the risk factors and you feel something like this. It is always advisable to at least get an ECG done to know what's happening. My sir's professor, he was a professor of medicine, so he had abdominal pain and he gave himself IV Zantac, this for the acidity. And he didn't get better. And then he took an ECG, it was an MI. So professor of medicine didn't understand what was that he had a heart attack. So it can be very tricky. So you have to be careful about it. So the warning signs are shortness of breath. So you have breathing difficulty. You may have sweating. Okay, you may have nausea. You may have lightheadedness. You may feel giddy. And sometimes you may have nothing. You may not have anything. Okay, especially for people who have diabetes mellitus, sugar. People who have sugar, it may affect the nerves. So when it affects the nerves, you have what you call neuropathy. So you may not know the pain. So in diabetics especially, you have to be careful. They may not have pain, but they may have other symptoms like breathing difficulty. So one thing is, if you're getting any of these signs, especially if you're really sick, what you must do in Kuwait, in the West, it is 911, but in Kuwait, you should call 112. Or if you're healthy enough, you can go with your spouse or a friend to the nearest emergency center. And if you're a known heart patient, you have something called nitroglycerin or sublingual GTN. It's a small bottle and you can put it under the tongue. Now, if you're not a known heart patient, if you have an aspirin, so it may be advisable, I would advise people to keep an aspirin, not the coated aspirin, the plain aspirin, the big one, okay, not the baby aspirin. So it's 160 to 325 mg. So so this is the big aspirin and you should chew it, So when you chew it, why we tell to chew it? So then it can get absorbed faster, okay? So if it is coated means it will get released only after it crosses the stomach. So you want the action to be fast. So it may be advisable for everyone to keep aspirin dose 325 or 160 mg of aspirin in the house. And if you're really sick, you have to rest till the ambulance comes. Now CPR, cardiopulmonary resuscitation. So I would advise everyone to have at least once to do this course. This is basic life support, BLS. This is something which can be life-changing for somebody. Hopefully not you or your loved ones, but even in the in the mall or anywhere. And all the malls, the airport, they have their defibrillator. The shock. They have the automatic defibrillator. So if anyone has a chance, you should. Actually, I would advise everyone to go for this course. It is freely available in Kuwait. It's not free. You have to pay for it. But I'm sure you'll have a lot of sponsors for that. So it takes only a few minutes to save a life. And CPR and defibrillation, if administered early, can triple or quadruple a person's chance. All the studies have shown that, the maximum death of when you have a heart attack occurs outside the hospital. So if you have this course, it can be really beneficial. So how big is the problem? As I told you, it's the #1 killer disease in the world. And during the last 30 years, large declines have occurred in the developed countries. But in the developing countries, especially India, it is going up and up. Now, I'll give you some facts. Okay, so coronary artery disease occurs 10 years earlier in Indians compared to Westerners. Unfortunately, it's really going. So as I told you, it used to be a disease of as you get older, but we are seeing the reverse trend now, especially in the Asian population, and And especially if you live in the cities, you have a 3 times higher chance of suffering a heart attack. Okay, so you have benefits, you have pros and cons. So, so we all live in cities, and we have a much higher risk of getting a heart attack. Now, India has the highest rate of heart attacks in the whole world. Okay, so China has a bigger population than us. You can say we have a bigger population, but they don't have as much as we do. So we have a big population. So why is this an increase in this population, the younger group? So you must realize it's not an overdiagnosis. So it could be because of lifestyle changes. Everyone wants to. We all going to the West. We are not in the West. We are in between. And we work 6 days a week here. If you're on the government or some good private companies, it may be 5 days a week. And we are living in a result-oriented society. In the past, we used to, what was just important to do your job well and enjoy doing it. But now it's, you need results, especially everyone needs results, especially the chartered accountants. You all have the targets, And we Indians, traditionally, we take a higher carbohydrates. We take more carbohydrates, and we're not traditionally we're not very active people. Due to many reasons, our culture, our interest in sports, and maybe the space, facilities, everything. And because of that, what happens? We get more obese, we get diabetes, and then we get heart disease. Hereditary, yes, there is a factor hereditary, but everywhere there is, not only India, the genetic factor can be there all over the world. I published a study around in 2011 in the International Journal of Heart. And because we saw this again, people less than 35, it's the big numbers we were seeing. We were getting surprised, what's happening? Why are people so young getting heart problems? So we did a study, and there are a lot of Indians and Bangladeshis. And in our study, what we saw that the main risk factor was smoking. Okay, smoking was the main risk factor in the younger population in this study. It's around 200 patients. So this is what we found in our study. Now, if you have some chest pain, you have some stomach issue, or, we have two sorts of personalities. We have one extreme personality who wants to do all tests to know if they are okay. And we have the other personality who are very relaxed, they are like, chalta hai, only when something happens, we look into it. So the people who wants to get tested, you can do the simple test is a treadmill test, the stress test, where you run in a treadmill, and we do an ECG and we see it. If you want a little more advanced, this is about 70% we'll pick it up. Okay, 30% we will not pick it up. If you want a more advanced test, something called a nuclear test, which is around 85, 90%, or a stress echo, similar. Now, CT calcium score was going up quite a lot. So if you have a calcium score around more than 100, you're at increased risk of having a heart problem. CT coronary angio. So I remember when Ganguly got a heart attack, and he's an athlete, a fit guy. And then Dr. Devi Shetty, who was from Bangalore, Narayana Hridaya. So he said everyone should get a CT angio. So Ganguly is a healthy guy. Why didn't find? So it's a wrong thing to say that everyone should get a CT angio. That's a wrong thing to say. But if you have risk factors and if you have some symptoms, you're not sure, it is a very great negative predictor. So if you do a CT angio and you see there is no blocks at all, then you are 99.9% sure that nothing's there. Now, if something is there, you're not very sure. And of course, if the gold standard is the coronary angiography, where we put an artery wire into your heart and see the arteries clearly. So that is the last step. So we don't do it for anyone, just for screening. Only if it's really needed, we do it, because it is an invasive test. Coronary angiogram is an invasive test, so it has a small percentage of risk, so why do you want to do so that small percentage of risk, we have seen it happen, it's very small, but why to do that unnecessary unless it's really needed? So most people, we can manage just the coronary artery disease with just lifestyle changes and medications. Okay, so, but those people who have too much of a problem, we have no choice but to do angioplasty or surgery. So Angioplasty, what we do mainly now is what is called a stenting. Okay, so I think you all have heard, everyone has heard about stenting. There are two types of stents. There's the bare metal and the drug eluting. Drug eluting is where there's a medicine in the stent, so it will have a less chance of blocking. In the government, they give free the bare metal, but the special set stent you have to buy. The prices have now come down a lot. It has come to 250 KD only. So if needed, this will be put if there's a block. And as there's a block in the artery, you will put the wire, and it will go. This is the block. It will go to the block, and then we will blow it up. We'll balloon the stent, and then we will deploy the stent in the artery, so it will become open now. Now we also sometimes we have no choice but to do the balloon. Okay, so there is a block. It may be because it's a small artery, or now we also have special balloon which has this drug coated in the balloon. So those things, we just do the balloon. We just blow it up. We just blow up on the block, and then it's open, and then we remove the wire. Now, this is the same thing, which is showing there are different types. This is the balloon, and this is the stent. The stent, there are different types of materials. There's stainless steel, there's a polymer, cobalt. There are different types of that. And this drug-eluting stent is the term now. So you see the springs also. So in between that, scar tissue may develop. So to prevent that, the special drug is there to prevent the scar tissue to come in that stent, so it doesn't block later on. So the last, we have many treatment, but if there's no choice in certain conditions, we have no other choice but to do the bypass surgery. So as the term says, bypass, that means you are bypassing the block. It's like plumbing, So if there's a block, you have to go around it, So they'll put an artery around it or a vein around it. And so then the flow will come. So this is the last chance now, but stenting now has gone, the surgery actually is comparatively less now, because ever since the special stents came, you have a much better outcome. And so it's much less than before surgery. But of course, sometimes you have no choice, especially if you have multiple lesions, you are going to put too many stents. So those people, it's better to do surgery. So what are the risks you can for the heart problem? So something you can't do anything, as I told, is age. As you grow older, you're going to have problem. And sex, males are at more risk to have heart problem than females. And race, now we are at that risky race, the Asian population, as I told you, ours, now we are gone. And then family history, that's again something you just can't do anything. If your father has less than 55 years, he had a heart problem, or your mother less than 65 years, you have an increased risk of getting a heart problem. And something what you can change are all the other side in the right side of the box. So cholesterol is one of the top things which we can do something about. Okay, so everybody needs cholesterol. It is needed in the body, but the only problem happens if there's too much. Okay, so where does it come from? So it can come either from the liver, or it can come from the food. Okay, so it's coming. So we have to do it. Sometimes you have this familial, and the familial, it's there in the body. It's produced from the liver. You have no choice. Now, there are two types of cholesterol. You have the good cholesterol and the bad cholesterol. The good cholesterol is what is called LDL. Okay, so the LDL cholesterol is something that is the bad one. Okay, so we have to decrease the LDL. And the HDL cholesterol is the good one. Okay, so that is something which we should try to increase. The only way we can increase it is with exercise and a red wine or alcohol. That will come. I'll come back later. Now, obesity. Now, this is the major problem all over the world, and you can see over here also, something which is a real killer, and it's a vicious cycle. When you become obese, you will get diabetes, you will get blood pressure, you will get cholesterol will start going up. So it's everything. It's a package. And there are two types of obesity. You have apple pear-shaped or pear-shaped. The apple people are much more at risk, because the apple-shaped people, the fat is around the abdomen, chest, so it affects the internal organs. So, every morning my brain, tells me to exercise, and my body loves the idea. So we always want to do exercise, but that after some time, the spirit is willing, but the flesh is weak. Smoking is something which is a real killer in many ways, not only the heart, the lungs. It's something which you have to put a full stop. If you're smoking, there's one thing which, you have to stop. There are too many things going on with smoking. So this is something which people just don't understand. And it's a real addiction. I agree. It's a real addiction. It's a big job to stop. You start something from your young age and then you tell to stop, it's not a joke, So there are now a lot of smoking cessation clinics are there. There are drugs, there are psychotherapy. There's a lot of things which can be done if you're really, but the main thing is you should be willing to quit. Now, alcohol. Okay. So alcohol consumption, recently there's some controversy, but in general, the saying is, as long as you take 1 or 2 drinks, it's fine. So basically, we don't recommend drinking, but if you're drinking, you can drink 1 or 2 drinks. So what is that 1 or 2 drinks? So if it is alcohol, that is whether it's vodka or whiskey, 40%. So you can take, there are 44 ml is 1 drink. So that means 88 ml, so around 90 ml. But we'll go to lower. So that's the maximum, okay, in moderation. Okay, so if it's wine, it should be 150 ml, 2 glasses. Should not go more than 2 glasses. Exactly half of all this is for the ladies, because the ladies cannot drink like the men. So they are not supposed to drink like the men. And this is not a sexist comment, but this is facts. Okay, so the men can drink more and won't harm them, if the ladies do the same thing. Beer also, if it's 250 ml, you can have 2. So the main thing is, if you drink too much, you're going to have a lot of problems. So as I said, this is a very fine line, So you have to be careful in the drinks. But recently, especially red wine, people, because of its antioxidant properties, red wine especially is recommended. But recently, this year, actually, there was a study which said that, people who are drinking less, that means 1 or 2 drinks, they live, they have less chance of getting heart problem than people who don't drink, okay, or they drink more. So they said that those people who drink less, they have a healthier lifestyle, okay. So they are more smart, okay. So, you need control, to drink, not to drink too much, okay. So they're saying because they had living a better lifestyle, so that's why better lifestyles in the same more, they are more fit, they are more healthier, they are more conscious, they are smarter. So because of that could be the reason why they are having less heart problems than those who don't drink or drink too much. So it's getting a little more controversial now. But in general, if you want to drink, if you love to drink, then fine. 1 to 2 is the maximum, okay. Now, diabetes is and the big killer, it affects so many organs, and especially the heart. And you must remember all these factors, they get mixed up. They all come together, they add on and becomes much more. So you have to control each thing. So try to get out whichever risk factor, try to remove it from your body, and then everything comes down. The net effect will come down. So this is a proverb: misfortunes always come in by a door that has been left open for them. Okay, so there's a lot of things in our hand. So every day you make choices to try to help protect yourself and your family. In fact, protecting yourself has become second nature. You just do it. Okay, but do you know what you can do to help yourself from this number 1 cause of death, which is heart disease? For my car, I want the best mechanic. But for my own body, I follow hearsay and advice from friends, kitty party, local friends, just anyone, and decide for the worst. Okay, so we see this quite often, and these are some of the people, which we see, I have never had a test. I don't want to retest. If they have a test, I don't want to retest. Never been to a doctor. I hate them. Never take medicines. Great. If you're not, never been to, if you're healthy, it's fine. My BP is normal, so I stopped medication. Again, big disaster. Miracle medicines. So many of them. I am my own doctor, so no fees too. Okay. So these are all things in life. It just doesn't work out. So how do you prevent? Rule number 1, look before you eat. Okay. So you have to have a healthy diet. Okay. You have to have a lot of fruits, vegetables, and eat healthy grain products. And you must try to choose the non-fat or the low-fat products and use less fat meats. You know, fish is good, chicken without the skin, lean cuts. And if you can, switch to fat-free milk or skim milk, be great. You must always try to limit your food, which is high in calories, you know, and low in nutrition, especially like the soft drinks, candy, junk food. They are all big disasters, you know. There are a lot of trans fat, a lot of cholesterol. You must decrease your salt and alcohol, as I told earlier. So foods what are rich in cholesterol and saturated fats, the fatty meat, the liver, the fried items, all those tasty ghee and butter and cheese, and all those bakery items. Now, cooking oils, okay, this is always, there's so many controversy. Everybody's confused, which is good, you know, which is good. Is it olive oil? Is it coconut oil? Is it canola? So basically, it would be advisable to rotate, okay? So you can take olive oil for some time, then you can change it to canola. The thing is that once you burn these oils, you know, it changes, you know. Now, if you're taking it on the table serving, there's no doubt the best is olive oil. You know, the Mediterranean diet is the best. There's no doubt about it. But once you cook, everything changes. So you can try to rotate it or mix the oils. Number 2, exercise. Exercise is something you have to do. There's no shortcut to that. Not only makes you fit, you lose all the calories what you're going to eat, and it has so many other functions, and it reduces your obesity. And as I told you, HDL is something which there's no drug as yet to increase the HDL. There is a drug, but which has a lot of side effects, so it's not at all popular. So the only way is by exercise. And if you like to drink, you can have some red wine. And you have to lower the LDL. Again, exercise will lower the LDL. And again, it also helps in the control of diabetes and hypertension. So they have seen that mortality, the death is actually halved in retirement who walk more than 2 miles every day. You know, it's become half, you know. So there's no doubt that exercise is a big, big thing. And someone who's inactive has a great risk of having heart disease as someone who smokes, has high blood pressure, or has high cholesterol. Exercise significantly reduces the chances of diabetes and stroke. This is also something you see, not only cardiac, diabetes, stroke. Stroke is another big killer. And even the blood pressure. Now I've seen so many patients, you know, the exercise, you know, they can really reduce the pressure. So so what is the exercise we recommend? 30 to 45 minutes. And most days, usually 5 days a week. 5 days a week is what we usually recommend. You know, so somehow we should try to find to work. If you do more, great. You know, but this is the minimum. One thing is you don't have to say, oh, I don't have a gym, or I don't have treadmill or a cross trainer or whatever. You just walk. You can just walk. You don't have to do some high-fi exercises. Walking, if you can go to gym and all, great. But this walking is the main key. You know, there's no excuse. Something which we can do. If it's hot, you can walk at home. Okay, so there's something you have to do. Smoking, as I told, there's no shortcut. You just have to stop smoking. Okay, you just have to do it. I remember my old sir, you know, and this is early 90s. So he was a cardiologist, and he was a private sector. It's a very busy center. So, you know, in the private, you need money. You know, I mean, you're like, your patients are your money. So, so if the patient comes and he says he's still smoking, suddenly he'll get violent, he'll get up, get out. He'll say, so he'll say, you stop smoking and you come back to me. You know, so he used to be a very sincere cardiologist, so because you smoke and you take medication, it doesn't work. You're doing exactly two opposite things, you're taking medicine and you're smoking, so it doesn't work that way. It's, you can't have heaven and hell, and the studies have shown that the minute you stop smoking, it really helps you. The heart disease risk really decreases, and within 2 years, it goes back to a non-smoker level. It can go back. So something you can really help. And we see many smokers. If you have smoking friends, you'll see them coughing. The smoker's cough will all go. It has no doubt. And lung cancer. Recently, I'm seeing, especially the ladies. I don't know why is that. Lady smokers are very less. We don't see often. But we are seeing this in the younger population, ladies having cancer, lung cancer, and they're all smokers. So smoking is something that we just have to stop. It is too multifactorial. It's too many people get involved. And you have all those things. So all those things happen. So something we have to, not only it helps in so many other things, all the activities. And the rule number 4, and that's not your mobile, is your numbers. What are the numbers you need to be okay? Okay, so we have to keep their cholesterol, total cholesterol low. In Kuwait, we usually is the millimoles, which we are measuring. The LDL less than 2.6 is our target. And the benefits of reduction is, even if you're 10%, your cholesterol reduces, is 20 to 30% chance of decrease in your heart disease. So you must check blood in between. I remember we had a cardiac surgeon. He was a thin fellow, and suddenly, and very fit, exercise, and all. Suddenly, he had a heart attack, and we were like, "How this guy got an attack?" And we checked his blood; his cholesterol was very high. So he was a Seventh-day Adventist, and this is one of the Christian group. They are a little extreme, so they don't believe in checking their blood or giving blood. So he never checked his blood. Okay, so just that fact, the cholesterol caused him to have that heart block, and he ended up with a bypass. So if you haven't checked, you must check in between. If it's normal, it's fine. Have a yearly checkup. And BP is very important. We have to control our blood pressures and keep it in the optimal level, which is 120/80 or below 130/80. Some say 140/90. That's fine. And sugars we have to control. So again, I'm keeping on emphasizing the Life Simple 7, all these factors, stop smoking, physical activities, eat a heart healthy diet, keep a healthy weight, keep your blood pressure healthy, cholesterol healthy, and blood sugar healthy. So again, don't get disheartened, that because my family has got heart problem, my father has, my mother has, there are so many things which you can do to help yourself, and don't blame your parents that because of you I had this heart problem. There are so many things you can do which you can help yourself. This is a risk calculator. Okay, this is made by the American Heart Association. So you can go back, and it is freely available on the net. It's called ASCVD, risk calculator, atherosclerotic cardiovascular disease. So if you fill up all these things, it will give you a percentage. What is your 10-year risk to have a heart problem? Okay. So if it is more than 20%, you have to help you do your lifestyle, and you have to take a statin, which is the cholesterol medicine. So if it is between 7.5 to 20%, you're in the border zone, intermediate, not border zone, intermediate. And statin cholesterol may help, and you have to do all those things, what I told you, diet, exercise, and all that. So you can go back if you don't and check what is your risk calculation, and you can decide. So don't wait for a heart attack to take an action. As they say, prevention is better than cure. So basically, we don't have a second life, and we are not like the cats. So heart disease is often avoidable. Following a heart healthy lifestyle does not have to be complicated, and it doesn't mean you need to live a life of self-deprivation. Okay, so don't think that if you're a patient, if you're a heart patient, don't feel depressed. You're going to live a healthy life. That's it, And the main thing is we have to be happy. As Dr. Navjot Kaur, she gave a good talk. Our mind is so important. Thank you.
Thank you, Dr. Thomas. We have some questions for you right now in the chat box. So CA Sanjeev Pabrai asks, what is your recommendation for getting a CT angio for anyone over 50 to 60 years of age?
As I told, CT angio is a great negative predictor. Now if you're old, 50 and 60, I mean, yes, I would. I mean, again, it's the personality also. Now suppose you have to see the risk factor. Now the easiest way out, I would say, now I gave you this calculator. You can check your calculator. Okay, you can check your risk. What is your risk over the 10 years? So if your risk is high, then yes, you should do a CT angio. In general, I would not advise anyone above when Dr. Devi Shetty, after Gangulu's thing, and CT angio was going left and right. Everyone started doing CT angio. In CT angio, you are giving a dye. Okay, it's not invasive, but the dye can affect your kidney. So normally they will check whether you have a kidney problem. But yes, if you're 50 years, it doesn't matter. I mean, I think there's not a problem if you do a CT angio. Now the next problem comes if the CT angio shows something. Now if you're an anxious personality, then you're going to be worried. Then what do I do next? If it's mild, now you have some blocks, 20%, 30%, 40%. So I would advise you to don't take this decision on your own. I would advise you to go to a cardiologist or your physician, your family practitioner, and get his advice. But if you have risk factors, yes, I would advise you to do a CT angio. I'm sorry, I can't hear you. Huh?
Is there a new thing called CAD angio, which is more advanced than CT angio? This is also asked by CA Sanjeev Pabrai.
Yeah, see, CT angio is a standard. We have now a lot of this. The slice is getting higher and higher and higher. There are many other tests which is coming up, but CT angio of the non-invasive, it's like a standard. This is more than enough. In the CT angio, we also have a calcium score. We can do also calcium score. So as I told this, if there's calcium in your arteries, so if it is more than 100, that means you're at increased risk of heart problem. And that means you have to start medication. So CT angio would be the best bet. You don't have to go for others.
Thank you. Next question is, can we reduce the old blockage percentage by exercise, walking?
Unfortunately, no. Though some studies have shown that some of the medications, there are many medications you give once you know that you have heart problem. There are many medications which they say some studies have shown that there is some regression. That means there is some decrease in the block, but usually you don't expect that. Now, what happens if you're doing exercise and all those, if you have a block, and you have a healthy lifestyle, you can have natural bypass. Okay, so suppose there's a block. So your body starts building another artery to bypass the block. So you have a natural bypass, so it will help you. Okay, so that is the answer to that question.
CA Gyanesh asks, can you please name all the hospitals which conduct CT angio or CAD angio in Kuwait?
Actually, all the government hospitals have all the means the area hospitals and the tertiary care is my hospital, Chest Hospital. They all have. In the private, it is there in Darul Shifa, Muassat, Al Salam, Hadi. They all have. The expertise is now improved. Earlier, it was sometimes you used to see a lot of crazy reports. CT will show one thing, and when you do angiogram, it will show another thing. But now they have that learning curve. You need it is now they have really improved, and the diagnosis is there. So if you have insurance, you can go to any of the private. I'm sure all you people have got private insurance, so you can go to any of the private hospital. Al Salam and Darul Shifa, I have found it one of the most reasonable in the reports what they give. Basically, it's a simple test, and we just want to bring the only we'll ask if there's any allergies, because you're giving a dye. So if you have allergy, they will give you steroids 2 days before, not to have a reaction. And as I told you, the kidney function, they'll check your renal function to see if you have any kidney problem. So that's the only thing. And one thing what we want is we want the heart rate to be down. So we like to keep the heart rate below 70. Then we can read better. So if your heart rate is fast, we may have to give you some medicine to bring it down before the test.
CA Rabin asks, at what frequency should we go for a health check?
Once a year will be reasonable. If you don't have major risk factors, once a year is reasonable. As you get older, not at a young age. So let's say about 40, 50, yes. Once a year would be reasonable.
Another question from CA Noel. He asks, what is the reason for the high number of post-COVID heart attack deaths? COVID is still around, so how can we diagnose even though we don't have any symptoms?
See, COVID related in the heart, we have seen very, very few, but it could be coincidence, okay? But yes, we have seen some, after COVID, we have seen myocarditis, it's an infection of the heart. Because it's a virus, COVID is a virus. So it attacks the heart, and the heart becomes, pumping becomes really down. It's very rare, we see it very rarely. There were some heart attacks and all we used to see. It could be coincidence, it could be coincidence. But these people who have COVID, especially who have severe COVID, their body is in a hypercoagulable state. That means their body can easily clot, So those people who are very sick, they may be prone to get some clot. So they usually give medicines to thin the blood, so there won't be any clots. But heart attack per se, because of COVID, I think it's a coincidence. We do see patients. Sometimes I think, is it too big a coincidence? But we do see patients. But I would not worry about it.
Thank you, Dr. Thomas. I think that's all for the questions. Are there any more questions? Members would like to ask any more questions? I think that's it. So I'd like to, does anyone want to ask a question? CA Deepak?
No, I think we are done.
All right. Thanks a lot. I would like to invite CA Surin to give the vote of thanks.
Thank you, Andalib, and the wider committee for allowing me and giving me the opportunity to deliver today's vote of thanks. So on behalf of the Kuwait chapter of the Institute of Chartered Accountants of India, I would like to extend our sincere thanks and gratitude to our esteemed speakers, Dr. Thomas and Dr. Navjot. Today's was a very insightful and impactful session, and I'm sure our attendees enjoyed listening to your valuable advice just as much as I did. There's certainly nothing that's more important than our physical and mental well-being, and we are truly grateful to have had a chance to listen to your valuable advice. I especially enjoyed the part by Dr. Navjot around happiness, what we are doing wrong in terms of contributing negatively to our own happiness, and what we can do to achieve personal happiness. Also, Dr. Thomas's advice around physical health, the importance of prevention, and also the importance of focusing on it early on was something that I think we should all focus on and learn from. Also, I would mention that Dr. Thomas, your presentation slides were excellent, that allowed us to understand the technical issues more easily through those great visuals. We really appreciate your commitment, enthusiasm, passion, and dedication to conduct today's session for the benefit of the members of the Institute of Chartered Accountants of India, Kuwait chapter. So thank you again for your time. Next, I would really like to thank all our attendees today. Even though today's was an evening session on a weekend, we managed to gather an amazing number of participants. So I thank you all for making the event successful and interactive. The success of any chapter's events is only and only possible because of the members' continuous commitment towards the chapter's activities. So thank you again to all our attendees. Last but not the least, I would like to thank our sponsors, Oracle, Al-Mullah Exchange, Mughal Mahal, and the National Bank of Kuwait. Thank you for your continuing support for the chapter and its activities. Lastly, thank you all and have a pleasant evening ahead.
I would also personally like to thank Dr. Thomas for taking his time out and bringing us such wonderful information. It's life-saving information. Thank you so much.
Thank you.
Thank you, Dr. Thomas. Thank you very much.
Thank you.
So with that, we close the event for the evening. Thanks again to all the members who came in large numbers. Thank you.